Hello everyone, this is Dr. Meenakshi. I'm back again with another topic in sociology. Today we are going to cover the topic suicide, and I'm going to tell you what we are covering today: the meaning of suicide, what are the characteristics of suicide, the different types of suicide, what is the Indian scenario in context of suicide, what are the major concerns over the society, and what are the various measures that can be done in order to prevent suicide. Suicide is the act of killing yourself, most often as a result of depression or mental illness. In simple words, suicide is the act of intentionally causing one's own death. That means intention of the person of harming himself or herself, leading to her own death, his own death, is very important. That means the victim should know in advance that the act is going to destroy him or her. Amelie Durkheim, as an eminent scholar, tried to explain suicide as any death which is the immediate or eventual result of a positive or negative act accomplished by the victim himself. However, the attempt of Durkheim to define suicide led to many objections and interpretations, but his book, titled as Suicide in 1897, was the first methodological study of a social fact with the case study of suicide, and it is the most famous study ever done on the topic suicide. Now, what are the different characteristics of suicide? It is the act of self destruction. Second, the victim knows the result of the act. Third, the factor responsible behind the act are social, not personal, according to Durkheim. The fourth one, the rate of suicide in any society is the characteristic of the society in consideration. The rate of suicide in any society depicting the characteristic of the social structure of that particular society in consideration. Now, what are the different types of suicide? This classification is again given by Amelie Durkheim. First is egoistic suicide. That means when a person is socially isolated and is not connected to any place, he may have that suicidal tendency, he may commit suicide. Second, altruistic suicide. Altruistic suicide means over integration with the societal norms, values, traditions. For example, in Indian context, sati pratha was prevalent in pre-independence time period, when the women were so over-regulated with the societal norms that they are ready to sacrifice their life at the event of the death of her husband. Anomic suicide, any breakdown on the society, any normlessness in the society may create suicidal tendency among the people. For example, right now in the phase of lockdown, many people are facing uncertainty, fear for future, and this may create suicidal tendency among them. The last one is fatalistic suicide. Fatalistic suicide means over regulation by the society over the society members. For example, a student who has experienced depression and stress due to the academic pressure created by his parents or the teachers may create suicidal tendency. So this is called fatalistic suicide. Now, what are the various causes of suicide? The causes may be different for persons of different age, caste, class, status. However, we can discuss few of the common across all the different categories. First is hopelessness. Second, drug abuse. Third, performance failure and pressure. Fourth one is loneliness. If the person experiencing loneliness, like in India, many of the parents whose children are studying or working abroad, many of the old age parents especially, and sometimes at the time of after the retirement, people experiencing loneliness, and this may create suicidal tendencies among them. Fifth one is, of course, mental illness. Many of the mental disorders led to suicidal tendency, led to eventually suicide among the patients. Stress and depression is one of the major cause or factor responsible for the suicide rate among youth in India. Seventh, sudden loss of job, property, or fraud. Now, what is the Indian scenario? Indian has the highest rate in Southeast region in 2016 according to the report released by WHO at the rate of 16.5%. It is highest for the female also, which was 14.5%. Farmer suicide is a biggest concern in India, and further, suicide was the most common cause of death in the age group of 15 to 39. So this is something very alarming when our youth is committing suicide, when the suicidal tendencies are prevalent among the youth in India. This is something very much needed consideration. Now, what are the various measures that can be taken in order to prevent suicide? First, better treatment of person with psychological disorders, their identification, their diagnosis, their counseling is must in order to prevent development of suicidal tendencies among them. Second, promotion of not only physical but also mental health being, so that our youth is better able to tackle all the stress and depression that that competitive scenario, the cutthroat competition creating among them. Strengthen social support network, so that in the event of uncertainty, in the event of any emergency, like in this scenario of lockdown, if we have a social support network to help the needy, to help the old age people, to help the poor, there will be less chances of committing suicide. Like in case of farmer also, we can extend a better social support system to prevent suicidal tendency among them. And the last one is training to various healthcare providers, because there is a study which showed that a person who has committed suicide has visited in the last 1 year at least one healthcare provider. So the health care provider should be provided a training so that he can identify the various suicidal symptoms among the patients, and that can be treated well in time with the help of counseling, with the help of other measures. So that was all for the topic suicide. We will meet soon for another topic. Thank you.